Are we recording?
You're recording.
Ring that bell.
We're live.
We are live.
Are we live?
We are live.
Yeah, the UK is recently announced that they're gonna stop. What is it? Loosen the restrictions. Actually, stop all the restrictions. Basically, in some starting right away. Some starting next week, I believe, Thursday. What do you guys think of this? Is this gonna be? That's my favorite line to say. What do you guys think of this?
What do we think of it?
I don't know. Some people think it's a little too early.
Do they? They think it's too early.
Too early. It's only the third year of this. Definitely too early.
Yeah, it's too early to actually go back to living our lives normally after 90% of the Western world is vaccinated. And we are experiencing mild symptoms from this new version of the virus.
Correct.
Well, Michael Lee,
Yes.
may I ask you to, let's pull up the article, or I should say video, of what they actually did announce in the UK, because I believe this is the first place where these restrictions are actually being completely removed, if not completely removed, almost entirely removed from being mandated by the government. Pull it up.
This morning, the Cabinet concluded that because of the extraordinary booster campaign, together with the way the public have responded to the Plan B measures,
Nice crazy hair.
we can return to Plan A
I have
in
hair like
England
that.
and allow Plan B regulations to expire. As a result, from the start of Thursday next week, mandatory certification will end. Organisations can, of course, choose to use the NHS COVID pass voluntarily, but we will end the compulsory use of COVID status certification in England. From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere. Mr. Speaker.
So excited.
They sound like a bunch of kids at school. They won't shut up so the
Mr.
teacher can
Speaker,
talk.
From tomorrow, we will no longer require face masks in classrooms, and the Department for Education will shortly remove national guidance on their use in communal areas. In the country at large, we will continue to suggest the use of face coverings in enclosed or crowded spaces, particularly when you come into contact with people you don't normally meet, but we will trust the judgment of the British people. And no
All right, cut
longer
that there. That's enough of that.
Well, when are they going to trust the judgment of the Canadian people?
I like what he said there, actually. Trust the judgment of the UK people.
Yes.
Is that something that we should actually be doing more of? Trusting everyday citizens to make their own choices in terms of their own health precautions for a mild virus?
Yes. Yes, we should.
When this guy is actually fighting for his political career here. It's more of a political move, if anything. But is it really time to stop some restrictions, Michael Lee?
I would say so. It would be nice to get some of these restrictions out of here and kind of go back to normal. Whatever normal is now.
Well, why do we think they're doing this?
Doing what exactly?
Why are they removing all these restrictions? Because they're finally saying enough of all this. You know, it's not going away. There's not going to be COVID-0. So time to move on. You know, most people are vaccinated. Most people will be fine. So does it make sense to keep imposing these rules on people? Is it solving anything? Is anything being fixed by all of this? I know a lot of people feel like crap.
I don't think anything's going to happen anytime soon in this country, but I could be surprised. You know, the way it seems, the UK is ahead of us in terms of the epidemiological spread of this virus. So we're usually about a week or maybe up to 2 weeks, depending on transmission rates and that, in seeing a difference. So they've already hit the peak of the Omicron virus and are on the downward spiral. And just recently, actually, here in, was it today, I believe, did you read this? That the very popular federal doctor, what is her name?
Dr. Tam.
Yes, I believe she thinks that we've reached the peak and maybe on a downward spiral.
Well, she says we may have reached the peak, which is pretty inconclusive and not particularly helpful.
Well, given that the UK already has, and this is a fast-spreading virus, we may be getting there, we may not, but it probably is not too far along here. Do you think our federal government will take any type of leadership?
They haven't so far, so I would imagine not. And they're probably just going to continue scaring people.
Scaring people?
They're telling people to be afraid. Be afraid of everyone else. Be afraid of anyone without a mask. Be afraid of anyone who doesn't have a vaccine. Be afraid of anyone who's anyone.
What about that discussion we had last week where Quebec was threatening to impose a tax on the unvaccinated? Is that still occurring?
Are they still threatening? I don't know.
The way you said that, you said attacks. They're attack them for a second.
They're attacking
Like,
Quebec.
Attacks on
They're threatening to attack themselves.
They are attacking their wallets with heavy fines to be vaccinated for whatever reason. It seems ridiculous. I think they're at 89% vaccination. How much effect is that little bit of the population going to have?
Well, it's having very little effect, but that premier still seems to be quite popular in that province, so I don't know what to say. I mean, I sure wouldn't want curfews and any of that nonsense happening here.
Didn't they try to before with us, though? Didn't they try to give us a curfew before?
They went so far as to talk about it, but they never actually did it.
In BC, according to CBC here, Dr. Bonnie Henry says contract tracing no longer effective, recommends self-monitoring, urges vaccination. Article here is stated, we cannot eliminate all risk. BC health officials shift emphasis to prevent transmission of COVID-19. The article goes on to discuss that they are no longer using the contact tracing as a method for controlling the spread of the coronavirus. Are they a little bit behind? Why are people still actually doing contact tracing?
Well, did contact tracing ever actually control anything?
No, it just gave us
It didn't help.
some data.
It's just another thing now that, you know, the people who are more worried, it's another thing for them to point at and be like, oh, we're being failed because they're not doing this. It's like, well, they're not doing that because it wasn't doing much anyways.
The article goes on to say, Henry said the province is shifting its approach to managing the virus in light of the spread of the highly transmissible Omicron variant. Henry said there is no longer capacity to test everyone who thinks they may have contracted the illness, and that given that most people suffer mild symptoms when infected with Omicron, the shift will be towards preventing transmission.
Yeah. The big focus now needs to be on how to treat people who do get more severe cases. Because we can't spend our time obsessing over eliminating every single case of this illness. It's an endemic virus now, and it's not going away anytime soon. And the sooner we all just realize that and start figuring out how to move on with that as part of life, like we've all lived our lives to this point with some degree of risk every day. Every time you go outside, every time you wake up, there's some degree of risk. You know, you go to work, you could encounter a virus that could give you a cold or a flu. This risk has always existed. And now we have people who are not really thinking closely about this, and they're just sitting at home obsessing with the fact that they want every single trace of it to be gone. and that is not realistic, and it's not what's going to happen.
Testing is important for who? Because I mean, those rapid tests in this province, especially, as probably actually everywhere, are becoming less and less available because people want to know if someone's contracted this virus specifically, and they're not really seeming to be concerned if they've contracted some other type of virus and just staying home when they're feeling sick symptoms, you know. So who should be tested? Why are we worrying about lining up for PCR tests or asking for rapid tests?
I think it's a complete waste of time and resources, because it doesn't stop any spread from happening. It doesn't stop anyone from getting sick. All it does is create stats that can be used to create more fear.
I agree and disagree. What I'm saying is testing is important. I suppose only in the circumstance that if you are in a population or community in which testing should be required, that would be healthcare or some form of the vulnerable population.
Correct.
You know,
I agree
that
with
way
that.
we could test people in a care home, a hospital, or some, let's say, what other type of population would be vulnerable? Mostly those.
Mostly those, yeah. Because if someone arrives in the hospital, yeah, you probably want to have a good idea of why they're sick. But if someone has a runny nose one day, you know what? Honestly, who gives a shit? Stay home, stay home for a day or two till you feel better, and then go back to your life. You don't need to have a test to know exactly what's wrong with you. You were just sick for a couple days, and you moved on, like every other time that has happened in your life.
The only problem with that, though, is people are missing out on work and they're missing out on money. And I thought I heard something about COVID pay or some kind of sick pay you're supposed to get if you are deemed to have COVID, if you're staying home or whatnot for 5 days or whatever you're supposed to stay home for. I don't know if you get paid for that or not, because that's why a lot of people don't want to do that, because they just don't want to lose all the money.
Yeah, and that's a fantastic point that you brought up right there. And this requires a shift in the way employers treat their employees. I know I've had my experience working in retail and other jobs too, where you're not feeling well, and you phone in to let them know, and basically they just try to guilt trip you into coming into work anyways. It's absolutely a thing, and that kind of stuff needs to stop, because that's just exactly how any kind of illness will spread when that kind of thing happens.
Yeah, exactly. So I don't know if that's actually if there's actually been funding for businesses anymore to supplement their payrolls for COVID pay. I think that's strictly on the employers at this point in time. And if you're sick or not receiving sick days, I mean, that sucks, and that issue should be dealt with. But I mean, the initial point here is we're trying to stop the transmission of viruses in general, and especially the COVID-19. So sick days or not, you should be staying home.
Yeah, but if people aren't getting paid, they're not going to stay home. There's a lot of people out there living paycheck to paycheck,
and that's the discussion we're having.
They don't get to eat.
They need to be tested to stay home with a legitimate reason. So only having COVID-19 is the only legitimate reason for somebody to stay home when they're sick. That's a cultural problem in this society now that's probably changing. And should we move this discussion along from in terms of our healthcare system and society, that maybe some kind of form of paid sick leave by the federal government? Would Canadians support that kind of idea?
Wasn't there something like that being considered?
It was suggested. Yes.
Did it not become a thing?
I think that was only a specific pandemic measurement. We should look that up and find out if COVID pay was a specific COVID measure, because I think that was initially.
Was that what that CERB thing was all about?
No, the CERB was completely different.
Oh, okay.
That was what they call a social test for UBI. The actual COVID pay, I'm not too sure about. They did suggest a sick day, but I think it was a COVID measure that was only going to be implemented. It's not a national, like, universal system like we have for healthcare, but it would also increase our I should say decrease strain on the healthcare system by having people able to stay home when they are legitimately sick. And should it be testing that's required, or should it simply be some form of a virtual, should we say, meeting with your doctor that basically can give you a doctor's note, right? The CRB was one thing, but actually the other thing we're looking at for is Canadian Recovery Sickness Benefit. That's the information, Michael, you might have been thinking about.
Canada Recovery Sickness Benefit. This gives income support to employed and self-employed individuals who are unable to work because they are sick or need to self-isolate due to COVID-19 or have an underlying health condition that puts them at greater risk of getting COVID-19. The CRSB is administered by the CRA. If you're eligible for the CRSB, you can receive $500, $450 after tax withheld for a 1-week period. If your situation continues, you will need to apply again. You may apply for up to a total of 6 weeks between September 27th, 2020 and May 7th, 2022.
So there you go. There is a bit of a sick pay that you can actually get. So you do require probably testing for that. It's funny how they do have an end date right there. I guess that's when the pandemic is really going to end. May 7th,
It'll be
2022.
COVID will be gone by May 7th.
Yes.
We have it here from the federal government. Now, the problem with this is it's only for COVID-19. People do get sick with other things.
Well, that's what I'm saying. It's a pandemic measurement, and it was a good pandemic measurement. It does require, I guess, testing.
This needs to be permanent for things like the flu and other infectious illnesses, bad colds.
All right. Well, that's a policy that I guess we should have some form of government try to implement. Who would implement this? Our federal government?
I mean, they could start. I don't know. Generally, health information is handled by the province, is it not?
Well, yes, but the federal government is taking a ton of that provincial money and then reallocating it to the provinces. So they've been doing for many years lesser and lesser amounts to the provinces.
Yeah.
So they could afford now, with that little bit of money they've been scrapping to the provinces, by increasing funding to a project like this. Canadians love their universal care systems, and this would be another universal system that would benefit, I guess, a large portion of the population, and maybe help the healthcare system in general when people could be less concerned about calling in sick.
You could go a long way to help stop the spread of, cold season or even bad flu seasons just by getting people to stay home when they don't feel well. And it wouldn't be hard to do if they weren't going to lose out on money. But until we have some kind of system that's better than this temporary measure that only applies to one illness, we're going to keep having problems like that.
Fair.
Are there not some places that actually do have sick pay, though?
Some places?
Or sick days, sorry, that you can take if you are actually sick and still get paid for it?
I mean, yeah, large employers do have benefits, and even smaller employers, they do have some form of insurance that will likely cover the pay that is being lost or being delegated to a non-working employee at the time that they're sick. So, I mean, yes, some private and public employers do provide sick days. It's a benefit.
Yeah, but people who work in like the service industry, who are already not getting paid a lot of the time, they don't have protection for stuff like this. Those people have to go to work sick, and then that just creates more problems.
Well,
that's fair, but do you think, with how the pandemic has been, that people have been better at staying home when they're sick? I know we're talking about the whole, staying home thing, getting paid thing, whatnot, but on the other side of things, do you guys think that people have gotten better at doing that now because of what's going on?
I honestly, I don't think I can offer a legitimate opinion on this because I am someone who does have the ability to work from home. So I've spent most of this pandemic working from home. So I haven't really experienced that.
Fair.
Yeah, I agree, but I do think that there is a societal change, and what is occurring, people are more cautious around sick people to the point, I mean, that it is a fear-based thing, but you may be right. This may be leading to a societal change for the better. We may be getting a program like this down the road from federal government at some point, because we are realizing that the healthcare system is weak, and keeping people home is one of the best methods to stop the transmission of any virus, any sickness. So if we did have a system in which people were able to apply for some pay, and if we did have more people who were aware, we would have far less concern. I think society is thinking about this in terms of how people are reacting to others when they may or may not be sick. I mean, a lot of people who have worked in healthcare realize that if you're around sick people, don't come to work. They get paid sick days, right? I mean, it's healthcare, right? They've taken this precaution, but the people who do not consider these sick days to be beneficial are unfortunately the smaller businesses or contractors, or people who do not have a replacement for employment, and the employment needs to get done. Like service sector workers, they often need to be replaced and can find a replacement at some point, right? Some jobs you can hold off on doing some of the work for a few days, but there's also a society that is demanding production and deadlines and adding stress to everybody's lives. And with that being the case, there are people who just can't afford to be sick, and so they come to work sick. What's the answer to that? I don't really know. I mean,
Sick pay.
Yeah.
no, the work has to get done. That's what I'm saying. What happens if all of the police get sick for 2 weeks? You need
Anarchy.
to have, yes,
Pure
anarchy.
madness.
That's the exaggeration of my point. But I'm just saying.
That's when I get text messages from the Michael Lee that say, "Stay off the streets."
Exactly.
Stay off the streets.
You don't want to mess around. Didn't the police though just go through something like that where they didn't have a lot of people that were
They-
a lot of
yeah.
employees that were sick or whatnot?
Yeah, they had 170 employees sick at once or something like that. They declared a state of emergency.
Yeah.
Yeah, that did happen.
Yeah, that's exactly my point. A lot of employers are struggling with sick employees staying home even right now because of these what do we call them? The stay-at-home orders, basically, for your isolation periods, right?
Yeah.
So when you're being forced to stay home, and you may be better, but we're being concerned about being sick, like you're saying, it's straining the economy, it's straining the supply chains, and with that, well, we're experiencing higher prices and lesser availability of goods.
But this is somewhat of an unusual situation. I mean, generally, in most cases, an employee can stay home when they're sick and it doesn't shut half the country down.
Yes, this is an exaggeration of what I'm saying. What I'm basically saying is, if you have 2 employees in your small business, and one of them, and you need those 2 employees, or let's say it's 2 employees and a boss, right? If one of those employees is sick and you need 3 people to get a job done, what happens?
Well, perhaps you don't have enough employees.
They can't afford to hire another person.
Well, that's a problem.
That's the point I'm making. You know, sick pay is great for most circumstances, but in some instances, some people will come in sick or work sick. Mind you, I mean, we can still, as we've learned from this pandemic, we can take mitigating factors. If you're coming to work sick and you're functioning okay, wear a mask at work. Wear a good quality mask that keep people from getting sick if you absolutely have to show up to work.
This is something we can learn from some of, I think, the Asian countries where this kind of thing was already standard practice long before this pandemic came along. You know, if you're sick and you have to go out, you put on a mask as a courtesy to those around you. That's definitely something we should probably consider adopting here.
So the UK has stopped mandating masks and requiring people to have their vaccine passports. We're thinking mask wearing and choosing to be vaccinated and what have you will be choices that will continue throughout general health care. Currently, it's still being mandated in our country. Do we still think that the federal government or any more provincial governments are going to decide to lessen our restrictions and move towards society and life as it was prior to the pandemic?
Ontario's already planning it. They have a 3-step plan or something.
Yeah, I saw that.
And I'm sure Alberta will be on board with getting rid of restrictions as soon as possible. Saskatchewan right behind them.
Doug Ford to announce Ontario will loosen COVID-19 pandemic restrictions starting January 31st. Yeah, so starting January 31st, Ontario is slowly walking back the steps in terms of mitigation that they were using all these restrictions. Is it the end of the pandemic?
Well, it's the end of the pandemic and the beginning of the endemic.
And let's enlighten anyone who may not understand what you're saying. The pandemic was a virus that was going to rapidly infect everyone or large portions of the population, causing havoc. And endemic, what does that pertain, or what does that particularly mean?
Endemic is like the flu, where every year we have a quote-unquote flu season. You know, some people go out and get a vaccine for it, others don't. Some years it's worse than others, but it pretty much shows up every year, other than a couple anomalous years lately. And during a certain time period, it becomes more prevalent for a while, and then it fades out, and then next year, same thing again.
Doug Ford, in this article, the Globe and Mail, when the government announced a new round of public health restrictions earlier this month, including the closing of many types of businesses, it was done to avoid overwhelming the hospitals. We've heard that before.
Well, the hospitals were stretched too thin to begin with. This is a whole other issue that Canada really needs to examine, is this constant running our healthcare system at like maximum capacity, I guess, to save money. I mean, other countries are not required to do this, even other countries with universal systems like this. So perhaps there's something we can learn from that, because we were definitely shown by this pandemic that it does not work to run a system like this.
Well, do we think in this province, our lovely Premier, Heather Stephenson, which I know everyone in this room thoroughly approves of her work for as little as little as it's been, do we think that she will have any form of leadership, or is capable of any form of leadership, in slowing or removing any restrictions in our home province?
She will definitely wait until probably half the country has already done it, and then just announce that she had this brilliant idea that she's going to do it too.
Are we saying that Canadians follow the leader?
In the case of stuff like this, yeah.
Is that necessarily a bad thing?
Well, what leader are you referring to?
Currently, with the UK dropping restrictions, we've seen how the Americans have chosen to have a vast array of different responses to this pandemic situation. In Canada, it's been rather unanimous to have these restrictions and vaccine mandates, and we've not had many other opportunities for mitigation of the virus. Why is it that every premier and federal leader is basically saying the same thing?
I don't know, Josh. Why don't you tell us why you think they're doing that?
Well, firstly, I think it's poor leadership on their part. They're not very good leaders. Secondly, I do think there is some benefit to what they're doing, though. They do have the luxury of seeing what is occurring in other provinces before, or other countries, before it happens to Canada. With that being the case, we are seeing high transmission rates, less severe infection, and a high population of vaccinated people, creating some form of mitigation in its own right. So why can the politicians not start to walk back these restrictions and so-called mitigating factors more rapidly?
Why do politicians do or not do anything? Because they're afraid they won't get reelected because somebody won't like them. Not because it's the best choice to do for your province or your country. It's a popularity contest.
And that's what it comes down to. Politicians doing whatever they think is best for their vote, rather than what they actually think is best for you and me and the citizens that they are supposed to represent.
Correct. You've got a country full of people that have really bought into the fear of being afraid of COVID, and it's partly because our healthcare system is ill-equipped to handle the number of severe cases. Well, guess what? You're going to have a population that is more open to the idea of restrictions and lockdowns because they're scared of what might happen, and they're told that this will protect them. So because the population is more accepting of that, that's the leaders just pander right into it because these are the people that they want to reelect them.
Is there a way that Canadians, the constituents of these politicians, can actually be heard by these politicians? Because I've personally sent out emails on specific topics, and you know what I get from these leaders in response?
A vague, useless answer.
Do you even get a response?
You get, yes, a vague, useless answer or a generic response. They don't actually consider your concerns. They say they do, but they look at popularity, basically. They look at whatever statistics say is popular and have no true leadership. Yeah, politicians, they don't stand for anything, I don't think.
They stand for getting personal gain.
Personal gain, getting funded, and having power.
Yeah. That seems to be how you get elected.
Well,
How do you solve this problem? Because I don't know, but it's a big problem.
yeah, we should look forward into other political options for Manitobans and Canadians in general, and some form that the individual can actually consider the options that are in front of them, because I really do not like the opportunities that we do see.
Well, listen, if you're one of our 3 viewers and you've got some thoughts on how this could be solved, please comment down below.
No, I agree, but Adam, and share these thoughts with your friends and help us determine what exactly we should, as Manitobans and Canadians, be concerned for.
And how can we make things better?
I enjoy this Leak Spec podcast. We will debate and discuss all these points of view, and hopefully something more than COVID will come about, because I'm frankly tired of this discussion that's been forced upon most of us, and I know the sentiment is becoming much more widely accepted and discussed. How about you guys?
I look forward to talking about something else soon.
And that's what we'll do. We will move forward on something much more specific to our concerns and interests in Canada and life in general in this province and the rest of the world we will conquer.
All that next time.
Next time.
Some kind of Pinky in the Brain ending here.
That's right. All right, everybody. Bye-bye.
Bye-bye.
Bye, guys.